Today, we're getting under the hood of women's health with Dr. Shieva Ghofrany, a board-certified OBGYN practicing for over 25 years. She has used her own personal experience as a patient with endometriosis, pregnancy loss, weight loss surgery, and ultimately ovarian cancer to help her really understand women and how we think about our health. She is the co-founder of Tribe Called Thee, a platform to help women learn about all of the OBGYN health issues they were never taught. Dr. Shieva is getting under the hood of uterine fibroids.
I'm a general OBGYN. OBGYN is the acronym for obstetrician, which is the doctor who actually takes care of people who are pregnant, and gynecologist, which is the person who takes care of the rest of the women's health that has to do with our reproductive tract mostly. And we tend to be a combined group of doctors that do all the spectrum of the life cycle of women. Uterine fibroids are benign, and I'll keep repeating benign, meaning they are not cancer. They are growths within the muscle of the uterus. So they'll be called fibroids or fibromas or myomas. Those are all the same name for fibroids. And they can be in a few different places within the uterus, and many of our listeners might know that the uterus is made of muscle already. So anytime you have some kind of tissue in your body, there can be little spots of it that go awry and grow too much, just like a skin tag on your skin. But this would be a growth within the already existing muscle, but that growth ends up becoming too big and it's not supposed to be there. So technically, they're not normal because they're not what our body is supposed to have, but they're incredibly common. 70% of all women have them, and 80% of Black women actually have fibroids. So incredibly common. But many people will have very small ones that they never would have known about had they not, for example, had a surgery where someone looked at them. So this is my example of our uterus, right? And so this is actually, my daughter looked at this the other day and said, is the uterus really that small? And it really is this small. So fibroids can be in a few different places. They can be within the muscular wall here, because this is the inside of the cavity. So they can be within the muscular wall, they can be inside the cavity, or they can be outside. So 3 different spots where they can be as small as half a centimeter, or they can literally grow to the size of a baby. So they really can vary, and patients will have the entire spectrum of signs and symptoms of them that we'll talk about later. Sadly, we have really very little idea of what causes fibroids. We don't know in our body in general. When one aspect of our body, again, continues to grow, we don't necessarily know the reason. It means that those cells, those muscular cells that were supposed to get the signaling to stop growing because the uterus was already at the right size, just kept replicating. There have been certain theories throughout the years. Did they think that high ingestion of red meat, for example, but that really was never found to be true. We know that Black women, again, are more at risk for having fibroids. And because of that, they've tried to study, is there something specific within their genetics or with certain deficiencies like vitamin D deficiency, but no one has ever been able to find a succinct reason. And again, I like to stress how common they are because I think that when people hear about them, their first inclination, like most things, is, oh my God, this sounds terrible. But if they really know that 70 to 80% of us have them, and the majority of us will be completely asymptomatic, that's very calming. Millions of women are walking around with fibroids, and they and their doctor do not know it, because the ways we would know someone has a fibroid is either because they come to us with symptoms. For example, very heavy bleeding or very painful bleeding. And if anyone has those symptoms, please, 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 you deserve to have a pelvic ultrasound or some kind of imaging of your pelvis. And the ultrasound, otherwise known as a sonogram or sonography, is the easiest one to do because it is the least expensive and there's no radiation. Even saying that it's the easiest doesn't mean it's always so easy, because you need to go to either the doctor's office or a radiology department. So if you came to us with symptoms, we would do an ultrasound and we might see the fibroids within the uterine cavity or within the muscular wall. Or during your annual exam with your doctor where you have no symptoms, when she does a pelvic exam, especially the part where she has to put one hand outside of your abdomen and the other hand into your vagina, that's where she's trying to feel for anything that is larger than it should be. So she may be able to feel it then. That said, what's really interesting is a normal pelvic exam does not mean you don't have fibroids, because all the studies have shown that, especially those of us who have a slightly higher BMI, we actually can have something pretty large growing in our pelvis that somebody would not feel. And so it would have to be a pretty significant size for someone to feel it. So the two ways again would be I'm having symptoms, heavy irregular bleeding or pain, or my doctor just felt something. Or the third way would be I myself might notice I'm feeling more pressure on my bladder. I'm feeling like there's something that's sticking out a little bit. And if you ever have those symptoms, even if it's only for 2 weeks or more, please go see your doctor, because your pelvis is a funny place where things can grow. And this is one of the reasons why a lot of the gynecological issues go undiagnosed, because as women and people with uteruses and ovaries, we tend to ignore these symptoms. We tend to be told societally that, pain is pain, and this is just the way your cycle is going to be, or this is just the way a woman's body is. And that's merely untrue. We deserve to be evaluated so that we can learn, not in a way that should be fear-mongering, but so that we can understand what is normal, what is common, what do we need to address. And I think that there's so much more education. So it's wonderful that we can talk about things like this. Fibroids really can occur at any age, but the older we get, the more likely we are to have them through our reproductive years, meaning through those times until we are postmenopausal. In other words, typically a fibroid will not grow completely new after menopause, because there does seem to be some hormonal mediation. So that means that from the minute a woman starts getting her period all the way until she is postmenopausal, which let's say is about from age 11 or 12-ish to about her early 50s, she is potentially going to have fibroids growing. And again, it's the growths within the muscle of the uterus that are totally benign. So those can continue to get bigger. Certain times they might shrink on their own. For example, pregnancy is a really common time where an existing fibroid might just be discovered, because that's the time where you're having a lot more ultrasounds. But it also might be the time where you discover it because your pain intensifies. As the pregnancy grows, the fibroid loses its blood supply and it can shrink, or what we call degenerate. And that can be very painful, but not dangerous. So throughout, again, the woman's life cycle of her reproductive years, she really may end up having a discovery of those fibroids. But it's really important, again, to highlight to women that many of us have them and don't know it. It's not uncommon for me to, for example, be doing a C-section, a cesarean section to remove a baby. And I'll say to a patient, oh, look, it turns out you have a small 1, 2, 3 centimeter fibroid that never caused heavy or painful bleeding, never caused her any physical discomfort or pressure, and was only discovered because we're literally looking at the outside wall of the uterus. Once we know someone has fibroids, then we have to really have that conversation about what do we do about them, and do we have to do anything about them? First of all, again, I'll keep repeating, millions of us have them and they are asymptomatic regardless of size. We have patients with very large fibroids who absolutely, after a careful discussion where I really want them to understand that they can tell me if they're uncomfortable, they swear up and down they're not uncomfortable, and then they don't need anything done. Other women with even smaller ones, depending on where they are, for example, if they're inside the cavity of the uterus, meaning the part where the lining thickens and sheds when you have a period every month, if they're inside there, they might cause really profoundly heavy bleeding that people do not need to suffer through. So luckily, there's a bunch of different ways we can treat. We can use just traditional hormonal contraception, meaning the birth control pill, patch, or ring can be used to treat it. We can use hormonal IUDs that have progesterone in them, and that goes into the uterine lining and makes the lining thinner so that the bleeding is much less. We can use an injectable medication that really antagonizes the hormones, and that's actually in many ways the most effective, but it comes with side effects because it is shutting down your hormones to help shrink the fibroid. And then we have an oral version of that medication that seems to have fewer side effects. So there are more and more medical options on the horizon outside of even surgery that we haven't yet discussed. So we talked again about the 3 different types of fibroids, the kind that can be outside of the uterus, which by the way is called subserosal, the kind that can be in the muscular wall, which is called intramural, and neither of those will often affect pregnancy because they're outside of the cavity. But the third kind, which is called submucosal, meaning inside the uterine lining, we'll show our little model again, that is where the baby grows. So imagine if there is a growth in there, it can cause two things. First, it can decrease the chance of getting pregnant, because if the embryo needs to implant in the wall and there's a fibroid growing off of that wall into the cavity, it just merely is occupying that space and making it less likely to get pregnant. That's not common. In other words, you can get pregnant with a submucosal fibroid, but it might decrease the chance. The second issue is that it sometimes can cause a miscarriage if that embryo has implanted right over the fibroid where the blood supply might be compromised a little bit. Though again, millions of women get pregnant with these fibroids in the uterine lining that we don't even know about. So it's not that it is a high risk, but it is a possibility that it will affect it. Rarely we see situations where, again, the fibroid will degenerate. It seems pretty common that at about 20 weeks, if a fibroid is going to degenerate, that is the time. And that seems to be the time where the baby is kind of starting to rapidly grow. The placenta is starting to take a lot of blood supply. So the blood supply to the fibroid decreases and it degenerates, and that can cause really profound pain, though no harm to the pregnancy. And that can be treated in various ways. The other aspect is that occasionally I've seen if there was a very large fibroid pushing into the cavity, that it can actually push on the baby in certain areas. I had one patient in particular whose baby is completely fine and now perfectly healthy and normal, but one side of the baby's skull was pressed in a little bit, and they just needed to do certain amounts of molding of that baby's skull, because everyone hopefully knows that babies' bones are so malleable. So again, harm is very rare from these fibroids, but there are aspects that can come up that we really need to address. And then the last aspect is that during the delivery itself, that uterine muscle, which has grown several times its normal size to accommodate the baby, needs to contract once the baby and the placenta are out. And that has to happen so that the bleeding stops from the connections that the placenta has had to the inside of the uterus. Now imagine if you've had a uterus that's much bigger, is trying to contract, but it's got this growth of muscle that doesn't have the same contractile properties as a regular muscle. So that can sometimes lead to heavy bleeding right after the delivery. And that's something that we see and we're often able to control. It's so important for people to realize that when we use the word tumor in medicine, it has often been conflated and confused with cancer. Tumor is merely a growth of our body that wasn't meant to be there. Anything that is an extra growth is actually a tumor. Many tumors are benign. Some tumors are malignant. Malignant means cancer. In this case, fibroids are benign, period. All fibroids are benign. The confusing thing is that there is a cancer entity that is called a leiomyosarcoma. And so it is the cancerous counterpart to a fibroid. But what's important to know is that the fibroids do not turn into leiomyosarcomas. In other words, if you have a fibroid, you will live with it forever and it will not malignantly transform. It will not turn into cancer. The way we detect leiomyosarcomas are the same ways we detect fibroids. We would do an ultrasound or a CAT scan or an MRI, often in a patient who has heavy or irregular bleeding, or is postmenopausal and started bleeding, or who has a lot of pain and maybe feels something growing. So when we are doing these ultrasounds, we're doing it and often finding benign tumors like fibroids, but we really are doing it because we want to make sure there is no malignant cancer counterpart. The confusing part, again, for many people is that leiomyosarcomas are not always easy to find. And so there can be confusion when someone labels a fibroid as benign, and in fact, it is this malignant counterpart. That's rare because leiomyosarcomas tend to grow very rapidly, whereas fibroids tend to grow much more slowly. And again, leiomyosarcomas are rare. Fibroids are common. So if your doctor diagnoses you with a fibroid, please do not be scared. The odds are it's just a benign fibroid, but it's certainly appropriate to ask that doctor why they believe this is just a benign fibroid and what are they doing to support that diagnosis. Are they following up at a certain interval and telling you what to look for? Sometimes medications don't work, and sometimes people need or want to have surgery just because of either the effect of their actual fibroids bothering them or their lifestyle, where they don't have time to kind of wait and watch and see what medication is going to do. So there are different ways that we can remove these or affect them mechanically, I say, meaning there are a few surgical ways, and then there are procedures that will potentially stop the fibroid from growing or even help it shrink. One option is hysteroscopic removal. So if the fibroid happens to be growing in the uterine cavity, the one that we called submucosal, then we can go through the cervix with a little camera that is called a hysteroscope, and we can either shave that fibroid off or use another device at the same time that is called a uterine ablation, which is really meant to burn the lining of the uterus for people who have heavy or irregular bleeding, but it can also burn that fibroid, the surface of the fibroid. The second way would be traditional surgery, where we either do the open incisions or the laparoscopic or robotic way, where we remove the fibroids, again, either alone or with the whole uterus, called a hysterectomy. And then the third way would be a uterine artery embolization, which is where a interventional radiologist would put a catheter into the groin, actually, and push that catheter up to the vessels that feed the uterus. And they are able to actually selectively decrease the blood supply to the fibroids while still making sure that the uterus itself maintains its blood supply. So again, there are a variety of ways, and each person and their doctor really need to describe and understand their symptoms and where they are at that point in their life. Do they continue to want to have children? Are they at a point where they really can't take medication because of other risk factors or because they just don't have the time? So there are multiple different ways to attack this, and those ways might change over time in that own person's life cycle. I like to tell everybody the same thing about almost all the things that we experience as women. First of all, do not be fearful and do not be scared. Find a doctor or a provider that you really can collaborate and talk to, because you need to understand what the fibroids are. It's really good to know that 70 to 80% of women will have fibroids in their lifetime, even if they don't know about it. I often joke, people are walking around town right now with fibroids and they don't know it. But once you do know it, understand, are there reasons that you need to be concerned? Are some of your symptoms that you didn't realize were from your fibroids, maybe from fibroids? Patients sometimes say, oh, I didn't realize I was peeing more frequently, or I had pressure on my rectum, or it was hurting when I had sex. So understand what fibroids may cause, understand that they may not cause anything, and know your options between doing nothing, between using conservative medications, between using more aggressive medications, or surgical options. It sounds like a lot, but again, if you have a doctor that you can talk to, and if you listen to programs where you're learning a little bit preemptively, then you really can go into it really understanding your body and being more empowered and leading without fear.